Welcome to our show. I'm Todd Haugen with News Director Larissa Donovan. And joining us today is Dr. Bill Dix with Sanford Health of Bemidji. Dr. Dix, welcome back.
Thank you. It's nice to be back.
Good to see you again. You've been with us before, but it's been too long. You have been practicing in Bemidji for a while, and your specialty is pain management, right, Dr. Dix?
Right, pain management, and all aspects of pain, including headaches, which I think is what we're going to focus on today, is my understanding.
As this is Migraine and Headache Awareness Month.
Right.
Is this a common problem for people?
Well, I'll put it this way. In my practice, just about everybody has headaches, almost every one of them. And we've got about 3,000 charts for the Bemidji area, which is remarkable for a town that's only, 15,000?
Yeah.
Although we draw from a wide range. I get people from Duluth, Fargo, Grand Forks, International Falls, all along the border. But as far as headache itself, almost everybody at one time in their life is going to have a headache. Almost everybody. The statistics as far as migraine, which are considered the worst headaches, and they can be very difficult to treat, and they can be very debilitating, are more common in women. Actually, before puberty, they're about equal. Boys and girls get migraines, and then, strangely, after puberty, girls get migraines even more so, and it almost totally disappears in boys. And it no doubt has a lot to do with hormonal stimulation, as well as the social milieu. It's really important that we keep that in mind.
What do you mean by social milieu?
Okay, the situation that girls that are set up, usually genetically, by the way, to have migraines, often also find themselves in stressful circumstances. Periods themselves, menses themselves can lead to migraines that can appear maybe only during menstruation, but at other times also. But also just the environment they find themselves in, school stress, family stress.
Friend stress.
For
sure.
Pressure, violence. Women are subject to violence in our culture at far higher than many other Western cultures. And that is somewhat the baseline of why so many women have migraines. I forget who said it, author, maybe it was a male, maybe one of the reasons that women have so many problems is because they have to deal with men. So
I'll testify for that.
That sounds like something like Winston Churchill would say. I forget who it was, but anyway, they're very common. I've heard numerous statistics, but roughly, believe it or not, 15 to 20% of adult females will have migraine problems. Like I say, in my practice, it's almost 100%, because it's associated with so many other pain problems.
Right. Is the pain originating during headache, whether it's migraine or not, all caused by the same whatever is happening in the head?
No. Migraines are relatively specific. Most people feel that the fifth cranial nerve, the trigeminal nerve, has a lot to do with the setup and manifestation of headaches. Cranial nerves are nothing different than the nerves in your spine and the rest of your body, except these nerves originate in the head instead of in the cervical spine. But there are many triggers to migraines also, and some of these triggers are just environment. Every time I go to work, I get a migraine. Well, obviously, there's something wrong at work. When I come home, I get a migraine because my kids are screaming at each other, or there's certain foods. Interestingly, caffeine is a big trigger of migraine, yet it also can help abort the migraine. So thus, thus the formulation of Excedrin with caffeine therein is kind of interesting. And then one of the other meds that I often use, if Fiorinol or Fioricet, also has caffeine, when we know that caffeine can trigger migraines. But I have one kid who was really interesting. He was allergic to certain food dyes. And we have this whole list of triggers, and there's, yellow number 8 and yellow number 12. And he said, oh, it's not yellow number 12. It's yellow number 11. That'll do it. So some people really learn in detail what triggers their migraines, and some people don't. But if you would like, right now, I'd like to maybe go through the greatest and newest book called Advanced Headache Therapy by Lawrence Robbins. He's sort of the main guru now of headaches in the United States. But he says the treatment algorithm, keys to management of migraine. Okay. Practice good sleep habits is number 1. Okay, so almost everybody we see in the pain clinic has sleep problems. It's probably the main baseline of why people have so much pain trouble and why they can't get out of their pain problems is sleep.
For these sleep problems, could that be not enough sleep or not deep enough sleep, or
well,
a mixture of both?
Okay. It can be both. Some people, they're in bed for 8 hours, but they're maybe sound asleep for 3 hours, and they're tossing and turning. Ask the spouse what's going on at night. The one spouse, male or female, is his side of the bed or her side of the bed is fine, very neat. Wake up in the morning and it's the other side of the bed looks like some horses ran across it. I mean, there's just tangled messes. But if sleep isn't handled, if sleep isn't dealt with, problems are not going to go away. Now, we have all kinds of sleeping pills. We probably have more sleeping pills in our culture than any culture that ever existed, anywhere from all the way from alcohol to Zolpidem, A to Z. I don't like to use benzodiazepine, that is sedative type sleep medications, because they're relatively short acting. Once they wear off, people wake up and they're even worse. Even long acting ones are highly habit forming. They're controlled substances. They lead to many other problems. They don't deal with the sleep problem. They only pave it over a little bit.
They don't help to reestablish a healthy sleep pattern?
No, I don't think so. Dr. Sammy Karaz is the head of the sleep clinic at Fargo. He comes to Bemidji, I think, once or twice a month. But he also feels the same way about these benzodiazepines. Now, occasionally there isn't much you can do about it. They've gone through the sleep study. The only thing they found is, say, Ativan or something. Fine. If the sleep specialist says use it, go ahead. But it has to be dealt with. Okay. Right. Number 2 on this list is get rid of excess weight. All right. So these, and the next one, exercise daily. These 3 things are the biggest problem we have in our Western society now. We don't sleep properly. There's 2/3 of people in the United States are either overweight or, frankly, obese. I don't like to use the word obese or this terrible word morbid obesity. I mean, I'd hate to be called a name like that. So I just go by body mass index. So if your body mass index is over 25, but it's not at 30, you're overweight. If it's 30 or greater, you're obese. This is not a healthy situation. But you walk outside today, right now, go walk down the street in Bemidji. It's like the norm. When you see men and women with their bellies hanging over their belts and so on, it's typical.
No question. And we don't.
You stay away from me.
And we don't exercise.
No, we don't exercise. So those are, if you look at the National Institutes of Health, they talk about what is going on in America. Why, and then you also see ads, secrets your doctor won't tell you. Ostensibly because doctors want to keep making a lot of money, so they want to keep seeing you. So they don't tell you these important secrets. But I'm here today to tell you that those 3 things are secrets that you should get involved in right now, today, because if not, you are going to be miserable. And the people I see, most of them are miserable. There's virtually no cure out there. We can kind of help. And then the other thing, this narcotic thing we have in this country is outrageous, and people are too willing still to give them out. Part of this is promulgated by physicians, of course, but another big problem we have in this company is insurance companies. I could do a whole lot better treating patients if I didn't have to go through 200 different health insurance companies we have in this country. Some say this is okay, others say this is okay, or they'll say it's okay for a year and then they'll change their mind the next year. It's got to stop. I mean, if I could treat people the way they need to be treated, we would have a much higher success rate. Something so simple, like, for instance, Lidocaine. What is Lidocaine? It's a common anesthetic. If you go to the emergency room with a cut, they'll anesthetize the wound with Lidocaine. It probably costs 5 cents a bottle of the stuff. It's been around for decades. It's cheap. Lidocaine IV will knock out chronic pain and headaches within an hour and keep it off for days. All right? So I try to order that. Cheap, easy IV Lidocaine. They won't pay for it. And they say, well, it's still experimental. It's not experimental. It's been out there in the literature for years, decades. And yet we have this roadblock with these insurance companies. That, to me, is the biggest problem this country has, is insurance companies and pharmaceutical companies. They're basically stealing our money. Sorry to rant about this, but somebody's got to rant about this because it's awful.
Right.
So, as a doctor, you probably know more about the subject than most.
Well, yeah. Other than the insurance purveyors themselves and congressmen who are deep in the pockets of big pharma and insurance companies, they are paid massive amounts of money to be reelected and so on. So this corruption can continue in this country. It's basically got to stop because people are suffering because of so-called health insurance companies and pharmaceutical companies. Maryland just recently passed a law that said people who own these like, do you remember the EpiPen thing? $2,000 a pen.
That's a death sentence for a lot of people.
Yeah, exactly. And they finally passed a law that said you can't do that anymore. There will be no gouging of these medications. So hopefully that'll happen on the federal level, but the feds have to get involved and stop this tragedy that's happening to the people in this country.
Although doctors have to play their part too, Dr. Dix. It sounds like you're right in there, but the first thing to reach for isn't necessarily the prescription. As you've already indicated, there are sometimes other solutions other than taking some sort of drug.
Yeah, we call these non-pharmacologic approaches. One of the best treatments for migraine, by the way, is acupuncture. But try to get acupuncture. It's no insurance companies will pay for it. It's straight cash. There's a few practitioners of acupuncture in the Bemidji area. The only one I know of who uses true Chinese medicine type acupuncture, that is going with the old formulas of meridians and so on, is Dr. Bill Peterson, who is now at the VA. So he's inaccessible to anybody who isn't involved with the VA. But he's been very good with it, and it works really well. It works about as well, if not better, than most medications out there. And there's virtually no side effects. Although I do a lot of dry needling, basically using acupuncture needles, but where do you hurt? And we pop in acupuncture needles. Works great. It's called dry needling as opposed to acupuncture. But even if I do that in my own clinic, that isn't a cost thing either. I can't charge for it. So I just say I did it, and I can't put in any charge, so it's sort of a freebie. But so what? I don't think we should be collared by these inane rules that are out there that we have to follow. That could lead to consequences.
Dr. Dix, unfortunately, we're already out of time.
Really?
But you've already said
Give me
that
more time.
almost all of us get a headache at some point, if
Right.
not all.
Mhm.
At what point is it a good idea to see a doctor like you? When do you know this is just happening too much?
Okay, if you get a headache that's totally unexplained, that is, you didn't bang your head, and it's sudden, it's severe, one time is good enough to see your doctor, because you could have something going on, a brain bleed that could be spontaneous, a tumor, this sort of thing. But those are kind of rare. If you bang your head and it hurts in your neck and head for a few days, you can probably ride it out with some aspirin, Tylenol, ibuprofen, naproxen. These are all available over the counter. But if it stays persistent, and especially the biggest red flag is if you have neurologic symptoms with this. And some of the common neurologic symptoms are, for instance, half your vision is no longer there. That means you go in immediately. Or you can no longer speak properly, or half of your face is sagging, or your arm doesn't work. Then you go in immediately. So any of these kind of neurologic symptoms, whether it's in your head or further down the spine, like, I hurt my neck and now I feel numb all over my body, you have to go in to be seen immediately, because something drastic could be happening. So those are what we call red flags. So neurologic symptoms associated with headache should be seen fairly quickly. Okay.
Sure. Well, Dr. Bill Dix, we appreciate our time with you today. We could go on and on, but we'll just look forward to next time.
All
Thanks
right.
for coming.